Hi there, this is Jennifer. I'm the Teens Can Survive Program Director, and if you've already seen our video series, then welcome back. If not, then I'm going to give you a description of what the Suicide Crisis Center of North Texas offers. The first part is we have our Survivors of Suicide Support Group, which is those who have lost someone to suicide. It's a group that allows everyone to be able to grieve over this loss. And then we also have our volunteer crisis line, and where there's volunteers that are on this crisis line 24 hours and are able to dedicate their time to help those in need. And then in our Teens Can Survive program, we have several programs. We have our screenings, and where it's a 10 to 15 minute survey, and we're able to pinpoint kiddos who are, let's say, having suicidal thoughts or maybe other mental health concerns as well. And then we have our presentations, and where we offer information about the warning signs of suicide and how they can help those who are struggling as well. And this is offered for kiddos and also anyone that's working with children, including staff members, teachers, or anyone such as parents who are interested in understanding a little bit more about suicide and how to help. And then our other program is our Life Squad program, and where it's a peer-to-peer advocacy group, and where these kiddos are going through a 8-week program, and from there they're able to understand and learn a little more about mental health, how to advocate for other peers, and to help them whenever they're struggling as well. So what our topic today is going to be about is about self-injury, or the more common term is self-harm. So we're going to talk about the definition, possible reasons for engaging in self-harm, and then also how you can help as either a friend or a parent or adult in someone's life too. And so the first part, definition of self-injury, is any form of deliberate self-inflicted destruction of the body tissue which results in immediate damage. The common ones are cutting, it could be scratching, burning oneself, hitting oneself in general. And so a lot of questions we get is, why would someone engage in that? And there's multiple reasons, and we'll talk about some of the more well-known type of possible reasons. And first of all, self-harm is most often not a suicidal gesture, but more of a sign of, let's say, unresolved distress. And there's actually research that talks about how physical pain relief that follows after self-harm actually tricks the brain into perceiving the relief of emotional pain too. So that means the brain can't really tell the difference between being hurt physically and feeling hurt emotionally. And so sometimes people may use self-harm as a way to distract from emotional pain and feelings of numbness, maybe to control helplessness or powerlessness, to calm overwhelming or unmanageable feelings, or even maintaining control in chaotic situations in their life, or some form of self-punishment, self-shame, or self-hate. And they also can use that as a way to express negative thoughts or feelings that they may not necessarily put into words as well. And one of the big questions is how we can help. And this is just a very brief kind of introduction to how we can help, but I would definitely recommend that we seek treatment for someone that we're concerned about. So the first part is we need to be aware of warning signs, such as physical markings, inappropriate dress for the season, let's say it's hot outside and we're wearing long sleeves, or even frequent bandages. And we need to be aware of possible risk factors, such as it's hard for that individual to regulate their emotions. They may internalize problems, or they may blame themselves for some things too. So those are some of the risk factors. And the important part, just like when it comes to suicide, we do need to ask if they are self-harming. We listen non-judgmentally, don't, let's say, overreact or express discomfort or shock. And it's important to know our own reactions when it comes to self-harm and how that can be put onto other person when they disclose these things. So definitely being able to understand a little bit more about ourselves and to get comfortable and understand a little bit more about self-harm. And when we ask them, we want to specify on the concerns and take it seriously and validate their feelings and understand that person's perspective on the reasons and why they may self-harm. And After that, the biggest important part is to seek treatment from a professional and to address it as soon as we can, and to know that this is not a phase. This is something that, again, like what I mentioned earlier, it may be a sign of just unresolved distress. Well, I hope the information was helpful, and please follow to continue on with our other video series. Our other information will include protective factors, the teen brain, a little more about cyberbullying and safe internet use. All right, well, thank you.